Welcome to the 50 Up Club podcast. Today we're excited to have Dr. Jessica Turton, Director of Ellipse Health and lead dietitian, join us. With her extensive experience in nutrition and dietetics, Dr. Turton will share valuable insights into how our nutritional needs change as we age. We'll explore the importance of protein and healthy fats, the role of a low carbohydrate diet in managing diabetes, and practical tips for improving metabolic health. Dr. Turton is passionate about helping people eat more of what their body truly needs, and today she'll guide us through strategies to enhance our well-being and confidence with food. Let's dive into this enlightening discussion. Welcome, Jessica, to the 50 Up Club podcast.
Thank you for having me, Nancy.
I'm so excited to have you on today because you are a wealth of knowledge when it comes to nutrition and diet. And of course, we are what we eat. So that's such an important topic. And I really love your approach to treating your clients, being really offering really personalized nutritional advice. So let's get into it. My first question is, as we age, how do our nutritional requirements change?
It's a good question. I think it changes more than people think, and probably in a different way to most people would think. So one of the main things is as we get older, we do tend to experience a decline in muscle mass and lean tissue. And so one of the most important nutrients is protein, because that's really the building block for our body. It's the building block for bones, for muscle, for skin, for enzymes, for hormones. But given that aging does accelerate muscle loss, what that really means for your diet is aging increases protein requirements. And it's interesting because most people, for whatever reason, as they get older, feel that they need to eat less, not more. And so particularly for those protein-rich foods like meat, fish, eggs, dairy, nuts, seeds, legumes, we actually need to try and prioritize those in the diet more and consider increasing our portions, especially if we have any concerns regarding the amount of muscle that we have or even bone density. So I would probably say that's the most important factor to consider. But another thing we need to consider is energy, and more specifically, where are we getting our energy from? As we get older, we tend to have an increase in insulin resistance, and that can increase risk for chronic diseases like type 2 diabetes, obesity, fatty liver, and heart disease. And so with insulin resistance, what that actually means is our body is not as good at turning carbohydrate foods into energy that we can use. So a lot of people find that as they get older, they need to reduce their energy intake from carbohydrates, but replace that with a source of energy that they can use, and that might be something like healthy fats. So I would say they're the top considerations as we get older.
Great. Let's go on that path of diabetes, type 2 diabetes. Now, you completed your PhD on low carbohydrate diet for diabetes management, didn't you?
Yes. Yep.
Can you just talk a bit about that and what you found after conducting that research?
Yeah. So actually, before I started my PhD, I thought I wanted to do more research in type 2 diabetes. My dad was recently diagnosed with type 2 diabetes. He was trying to figure out how he can reverse that condition. This was before I became a dietitian, by the way. And so I thought that's where I wanted my research to go. But when I actually started digging into the current literature, I found that there is a lot of research for type 2 diabetes. It's like one of the most well-studied populations, especially when it comes to diet. And when you look at the research, it's pretty clear that low carbohydrate diets are the most effective approach for improving insulin sensitivity and reducing risk of heart disease and weight loss in people with type 2 diabetes. And there's quite a lot of studies that show you can reverse type 2 diabetes. And most of the people in these studies are over the age of 50, right? And so I didn't then want to actually do a research project that was just regurgitating information that was already out there. But one of my concerns at the time was that the research was there, but people didn't know about it. And so many people with diabetes were still following that standard dietary approach, which is high carbohydrate, low fat, and usually low calorie or small portions. And that was how they were trying to improve their diabetes management. And the problem with that is they were getting put on more and more medications every single year to try and manage this condition. And reversal of type 2 diabetes wasn't really spoken about. It wasn't a thing that people even knew they could achieve. And so I realized there was a disconnect between what was in the literature for type 2 diabetes and what was actually happening in practice and real life. And so I did look at a similar population. So I did start looking at type 1 diabetes, which still is diabetes. It's about how we can improve blood sugar control and insulin sensitivity. But now we're talking about an autoimmune condition where oftentimes people with this disease are a lot younger. But what I did was I actually pulled together all the research in type 2 diabetes, and then I started applying that to other clinical populations, including type 1. And so half of my PhD was actually about breaking down the science in type 2 diabetes, I guess making a case for how solid it was, and then showing how we could use that research in other clinical populations as well. And so I found that to be not just helpful for my research in type 1 diabetes, and we were able to develop a clinical trial that showed improvements in blood sugar control, weight loss, etc., all without calorie restriction. So I was very proud of that. But what I was even more proud of was that I was able to bring more attention to the use of low carb diets in type 2 diabetes and other clinical populations. And I was even able to present some of my research at the American Diabetes Association conference, and it was really well received. And now, and I'm not saying it's just because of my work, there's so much research out there, but now, fast forward 6 years or however long it's been, low carbohydrates are one of the standard options for people with type 2. And a lot more GPs and dietitians are using this approach. And so my PhD was focused on the outcomes in type 1, but I think from a practicality standpoint and a guideline standpoint, we really were trying to bring attention to the research that was already there for type 2 diabetes.
Excellent. It's good to know that the word is getting out there. Do you think it's out there enough? Do you think?
Probably not.
No.
So podcasts like this are very important still, I would say. I think the standard approach is still going to be you see your doctor probably too late. You find out you've got type 2 diabetes, when you kind of wish you knew it 10 years ago. And then you're likely going to be offered medication. Whether or not you accept that is up to you. And generally speaking, you'll be told to see a dietitian. And then it will be kind of luck of the draw as to whether you see a dietitian that is familiar with a low carbohydrate approach, or you see a dietitian that maybe is more so the prior higher carb approach. Now, both approaches can still work, but what we find is that a low carbohydrate diet can be successful without calorie restriction. And so what people find is that they're able to eat to satiety of nutrient-dense protein foods and healthy fats and non-starchy fruits and vegetables. And they're actually able to eat to satiety, meaning that they have a good relationship with food, they have good energy levels, they feel good within their body, they don't feel restricted on this dietary approach. And so it's not just effective in the short term, but because of all those other factors, they're able to sustain it long term. Whereas if you look at research in high carbohydrate diets or high carb, low fat diets for type 2 diabetes, they may show some benefit initially, but 90% of people are not able to stick to the diet because they get hungry or they become exhausted and suffer low energy. And then the diet fails and it's like, all right, I got to start something else on Monday, that sort of mentality.
When you talk about that last, the latter, what is the calorie allowance there? What are we looking at?
Yeah, so usually with high carbohydrate diets, the way that they work is by calorie restriction, which then causes the carbohydrate intake to come down. And that's still why it can be effective for people with type 2. But, an average adult at the age of, say, 60 probably needs around 2,500 calories a day. If they're particularly active, they might need more than that, 3,000 to 3,500 calories a day. And now if we think about a calorie restricted diet, generally that's going to be 500 to 1,000 calories less than someone's requirements. So you might be looking at 1,500 calories a day, maybe 2,000 at best, but it's essentially an energy restricted diet. And humans need energy, but people with type 2 diabetes actually need more energy, not less. Because one thing that happens in type 2 diabetes, when we're talking about insulin resistance, what that means is your body produces a lot of insulin. So you've got too much insulin floating around your system. Insulin stops your body from burning fat. And fat is a vital energy source that we as humans need to be able to access. We have fat on our bodies, we have fat in the diet. It's a very important energy source that we need to be able to use. And so you can imagine if your body is unable to use fat as an energy source because insulin is so high, the only thing you've got left to use is glucose, which usually comes from carbohydrate or it comes from production of stress hormones. So your body can make glucose. Now, the problem with that for someone with type 2 diabetes is that their body isn't very good at using glucose either. Because in order to turn glucose into energy, you need to be sensitive to insulin, because insulin is what puts glucose into your muscles, into your brain, into your cells where it can be used for energy. So these poor people with type 2 diabetes, they're being talked to like they're eating too much and moving too little, like they are the problem. But really what's happening on a physiological level is their body is screaming out for energy. There's all this energy floating around the blood and there's all this energy stored in the fat, but their tissues and organs are unable to use that energy. And so it leaves them feeling pretty crappy, right? Feeling terrible. And then these energy restricted diets make them feel even worse. So it is understandable why diet fails for a lot of people in this position, but perhaps it's because they haven't found the right approach for them.
This makes so much sense because when you think about someone who is starved of energy, even though they're eating, let's say, carbohydrates, they're eating some fats as well, they're going to lack the energy to actually meal prep, to actually get up and make a healthy meal. So they're probably reaching out for unhealthy options. They're going to lack energy to exercise. They're going to lack in it. They're going to probably want to sleep longer or not able to wake up, in the morning to exercise or whatever. So it's so important. It's like a vicious cycle. So we need to first get the food right, bring the carbohydrates down so that we are able to burn the fat, bring that insulin down, burn the fat, so that we're also burning the fat on our body. And so that's what you mean by not restricting calories but losing weight, is because you're getting your hormones correct, right?
Exactly.
Right.
Yeah.
Okay.
So a low carbohydrate diet works by reducing insulin levels and insulin requirements. So whether your body is producing its own insulin or you have to inject insulin, it doesn't matter where you are in terms of your diabetes stage or type. But what a low carbohydrate does is it reduces the requirements for that insulin, meaning over time you have less and less insulin floating around, which means your body can start accessing fat, whether that means fat stored on your body, fat stored in your liver, or fat in your diet. And then that actually causes your total energy availability to increase. So you can imagine if your body only thought it could access glucose for energy, the total pool of energy is very, very limited. So your thyroid is going to say, nah, we can't do XYZ today because we just do not have the energy capacity for that. We don't have the availability. But now let's say you've got this whole other pool of energy, which is fat to use. And so now your body's like, great, we have energy to tackle the day. We have energy to meal prep. We have energy to do that meeting or socialize or go to the gym or whatever it may be. And so your thyroid starts producing more energy or burning more energy. So it's like a double whammy. It's like you get access to fat as an energy source, but then your metabolism also increases because it has more energy to use.
So when you refer to a low carbohydrate diet, how does that compare to a keto diet, ketogenic diet?
Technically, by definition, a low carbohydrate diet is any diet with less than 130 grams of carbohydrates a day. So that's equivalent to about 26% of energy in the diet or less. Okay, so any diet under that amount is a low carb diet. And so within that umbrella term, we have ketogenic diets. And ketogenic diets are usually defined as any diet less than 50 grams of carbs a day. So they're a very low carb diet. The thing about the term ketogenic diet is really we need to look at each person as an individual to see A, do they need to be in a state of nutritional ketosis? Is that beneficial? And then B, how do we formulate the diet to achieve that? Because what a ketogenic diet really means is this is a diet that helps the body produce ketones and get into a state of nutritional ketosis, which is where the body is dependent on fat as an energy source. So you've pulled down the carbs so much that you're no longer using carbs and fat for energy, you're just using fat. And that's what nutritional ketosis is. And so there's a lot of research to suggest that this is a slightly superior diet for people with diabetes, especially if their goal is to reverse their condition and not just manage it. But nutritional ketosis, there's also a lot of promise for people with epilepsy or Alzheimer's disease, other mental health conditions, psychiatric conditions, even inflammatory bowel diseases, to actually show that the ketones themselves are anti-inflammatory. And so staying in this ketogenic state for an extended period of time can not just reduce insulin levels, but it can reduce inflammation levels as well. So it has therapeutic benefits that a regular low carb diet may not offer as much of. And so they are kind of the same diet, but also slightly different, if that makes sense. Now, my particular research project was looking at all low carb diets. And then I basically categorized them in terms of whether they were ketogenic or not, or very low carb or not. But the other thing that I just wanted to mention as well is for some people who don't have metabolic disease, so if you don't have insulin resistance or you don't have type 2 diabetes and you're relatively fit and healthy, you can actually still produce ketones on a higher carb diet. So it doesn't necessarily have to be less than 50 grams a day. You might be eating 100 grams of carbs a day, but because you're already quite insulin sensitive, your insulin levels can still go down very, very low at that carb level, and you can still produce a lot of ketones and get those benefits. So that's what I mean by individualizing it for the person in front of you.
Great. So you can still produce ketones if you're not on a ketogenic diet. So low carb is still good. And I think there's tests out there, isn't there? Like you can do little finger prick tests to see what your ketone levels are, and you can then tailor your kind of diet to that, I guess. Awesome. You did mention inflammatory bowel diseases, and I wasn't going to ask you a question on that, but I now want to. So the common advice given by specialists out there is that meat is bad for inflammatory bowel disease. What do you say to that? Like red meat, stay off red meat. That's just, yeah.
Yeah, and I think far beyond inflammatory bowel disease, I think we hear that red meat is bad for us, whether that be for weight management, inflammatory bowel disease, cancer risk, cardiovascular disease. We often hear red meat being demonized. And that's even true in some of the low carbohydrate studies we were looking at. Some of those studies were still restricting red meat. So it's not as if all those low carb diets were exactly the same. But what I would say to that, maybe a couple of things. So I think the first thing is when you actually look at the research to support those claims. So there are claims, we've all heard them, that red meat is inflammatory, that red meat increases your risk of cancer, that red meat increases your risk of heart disease. When you look at the research that is supporting those claims, what we're talking about here is epidemiological research, where they might have 100,000 people in their study, so big studies. They might have a food questionnaire, and they give these people in this study a food questionnaire at the beginning of the study, and these people have to tick these boxes, hundreds and thousands of boxes, where they're just like, okay, how many times a week do I eat apples? How many times a week do I eat pears? How many times a week do I have pizza? How many times a month do I have sausage rolls, right? So there's all these questions about how frequently you eat different foods. And then they follow this group of people up for 10 years, 20 years, however long the study goes for. And then during that time, they take note of who got cancer, who got autoimmune disease, who got cardiovascular disease. And then they start drawing associations between what they said in their food frequency questionnaire and then who got disease. So you can probably already start to think of a few problems with these studies. They're not fantastic studies, but let's acknowledge that they're good starting points, right? So if we start to draw patterns between, okay, well, this group of people were eating lots of red meat and they were the ones that ended up with inflammatory bowel disease, for example. So perhaps red meat is inflammatory. So this is kind of the conclusion that comes from these big studies. First thing to say is, could you imagine filling out one of those questionnaires, how wildly inaccurate it would probably be? So that's the first thing. The second thing is, oftentimes, we get people who are saying, yeah, I have party pies every single day. And then the researchers are categorizing that as red meat because red meat is in party pies. So there's not always a good distinction between the types of red meat here. But then the other thing is, even if we do find an association between red meat and inflammation or red meat and cancer, whatever, association does not cause causation. And so the next thing that needs to happen is we need to have randomized clinical trials or high quality clinical trials where we've got multiple groups of people. Maybe we've got two at the very least. We have one group of people that is fed a high red meat diet, and then we have one group of people that is fed a low red meat diet. And now we follow them. We do comprehensive testing at the beginning. We follow them for as long as we can, and we do comprehensive testing at the end. And then we can start to build that data that says, okay, this might be a good thing or it might be a bad thing. Now, the thing is, there is no randomized clinical trial or high quality clinical trial that shows red meat is linked with disease or inflammation in general. There is not one. So the association may be there when you look at these epidemiological studies, but it's just an association and a very weak one at that. The other thing I would say is that we have to look at the benefits of red meat, and we actually have to weigh up the risk and the benefit. So even if we were to accept that these large epidemiological studies showed a weak association between red meat and disease, and some people or doctors or whoever were still hung up on that association, we also then have to weigh up, well, what are the benefits of eating the red meat? Because red meat is very nutritious. It has a lot of iron, and it is one of the only good sources of iron. There's not a lot of great sources out there. It's a fantastic source of vitamin B12, and it's a great source of protein, which is a nutrient we were talking about earlier. This is really important for older adults in particular, but it's important for everybody. And so let's say someone is susceptible to an iron deficiency, or someone has sarcopenia or osteoporosis. And so red meat is actually really key in their diet. If they take that red meat away, they almost certainly will end up with an iron deficiency, and they might lose muscle, or they might find that their bone density declines, right? Let's just say that's an example. So we have some very real risks, right, that might happen if that person stops eating red meat. Now, if that person continues eating red meat, we have this very weak risk, right? That it may be associated with inflammation. And so we have to weigh that up for the individual. And so I think, I mean, personally and professionally, if we think about an iron deficiency or if we think about sarcopenia, that's a more dangerous outcome than a potential risk of inflammation. And iron deficiency, if it gets bad enough, that will be a source of inflammation, right? It's more complex than people think. I don't think we can ever say one food is like, gonna cause this or going to cause that. We definitely have to look at it on an individual level, but we also have to remember red meat, it's a minimally processed, nutrient-dense food. So it's not like we're trying to demonize lollies, which would be so much easier to do. I think most people would agree, yeah, lollies probably aren't a health food, right? But there's so much debate around red meat because it is nutritious and it offers so much for us. So even if there's potential that it may not be great for everyone, it has to be weighed up on an individual level.
Yeah, awesome. Okay, so what about vegans and vegetarians? Where do they get their protein sources?
So there are a lot of vegetarian protein sources, absolutely. So, even things like dairy and eggs, these are great sources of not just protein, but micronutrients. So you get a lot of B vitamins, calcium in those foods. And again, these are foods that are often demonized. Eggs and dairy are often demonized. So they are highly nutritious. But if we think about more sort of plant-based sources of protein, we're looking at nuts, seeds, we're looking at legumes, tofu, vegetables like mushrooms are a little bit higher in protein than others. But to be really honest, it is much more difficult to meet your protein requirements if you are following a plant-based diet. It is by definition, right? Because animal-based foods are higher in protein, and that's not anyone's opinion, they just are. But also, the form of protein is more biologically available. So these animal-based proteins have a complete amino acid profile, which means our body can use them easily to build muscle, to build bone, to build connective tissue, all of that. But the way that we digest animal-based protein foods, we actually extract more protein and more amino acids compared to when we have plant-based protein foods. And again, that is just a physiological trait of human beings. It's not anyone's opinion. Now, some people will do well on a plant-based diet, but I would say that would be the minority. I would say that would be people that are more tending towards being, genetically healthy. If we've got someone who has both parents with type 2 diabetes, both parents with heart disease, and they are, on the road because of their genetics to progressing that insulin resistance, then it's going to be much harder for them to get the energy and the nutrients they need from a plant-based diet. But if we're talking about someone who's physiologically fit and healthy and they don't have any gut issues, no digestive issues, no genetic susceptibility to chronic disease, they might do okay. So again, it comes back to that individual level.
How do you get 3,000 calories into you? Because when I've been on it, I try to eat healthy. Like you can easily get it, but like let's say a Big Mac meal, what is it, 800 calories with the chips and everything. But if you're eating healthy, how do you get that many calories in? And because some
So
people don't feel like eating that much food. So, yeah.
I guess what you're referencing is the post on Instagram where I said that I eat 3,000 to 3,300 calories every single day. And I do. That's not a lie. But I'm not saying that everybody should eat that much, just how much I eat. But I guess really the point I was trying to make with that post is that energy or calories, which is what most people think of energy as, energy is essential. It's one of the most essential components of the diet. And we like to demonize calories as if they're bad. we often still have that idea that if we eat too much calories, we'll gain weight, we'll be unhealthy, we'll be at risk of disease. So therefore, calories are bad. But if we had no calories, we'd be dead, right? So calories can't be bad. And so a lot of my education is around teaching people on why energy or calories are so important. And also on an individual level, how much energy do you as an individual need? Because when we look online, we see, such and such is eating 1,000 calories a day and they look amazing, or such and such is eating 2,000 calories a day and that's too much. And we just get all this like weird warped perception on what is a normal amount of calories to be eating. I think a lot of it comes from the low fat dieting era where we were basically told starving ourselves was a good idea. But there's a lot of good research to say that these low calorie diets, so they could be diets anywhere from 800 calories a day to maybe 1,600 calories a day. So these very low calorie diets, which are very common, these diets increase risk for mental health issues. They increase risk for eating disorders. And they also, over the long term, don't actually support weight management effectively and can lead to conditions like obesity and type 2 diabetes, right? So because that's still the mantra that calories are bad and we should eat less and we should move more, I like to tell people what I do, and I like to inform people how I educate my patients. And so one of the first things to think about when we talk about this topic is, how much energy does my body need to, like, a bare minimum to keep my organs functioning and to support my current muscle mass and my current weight? So what is the absolute bare minimum that I need just to survive? And this is what we call our resting metabolic rate, or our basal metabolic rate. Now, you can get this measured and do all these fancy tests or do these calculations, but honestly, for most women, if we think about women, it's going to fall somewhere between, say, 1,200 calories a day and about 1,500 calories a day. For some women with a lot of muscle, it's going to be closer to 1,800 calories a day. For most men, it's going to be somewhere between 1,500 calories a day and 2,500 calories a day. Now, to be clear, this is the amount of energy they need just to support their vital organ function. So this doesn't include sitting at a desk having a meeting like we are now. It doesn't include having conversations. It doesn't include working, socializing. It doesn't include going to the gym or even digesting food. All those activities require additional energy to your basal metabolic rate. Now, when you hear those numbers that I threw around, these are the numbers of most calorie restricted diets. So most calorie restricted diets or weight loss diets tell us to eat 1,200 calories a day or 1,500 calories a day. So we have men and women that are eating less than their basal metabolic rate, which means their vital organs are not getting what they need. So you can only imagine how that increases risk of diseases and mental health problems if the brain, for example, isn't getting energy or the gut isn't getting energy. And it's the number one stress for the immune system, is not getting enough energy. So now we're seeing autoimmune diseases on the rise. And so when I said that I eat 3,000 to 3,300 calories a day, that's based on the fact that my basal metabolic rate is around 1,500 to 1,600 calories a day. So that's the bare minimum I need. And then on top of that, I have a very mentally demanding job. And then on top of that, I'm pretty sleep deprived because I have a 19-month-old and I'm chasing her around, so I'm active. And then on top of that, I have, certain inflammation in my body, right? Which increases energy requirements as well. So that's actually the amount of energy I need just to keep myself going and to fuel myself properly. And so for most people, I would say, they think, whoa, that's way too much. But actually it's exactly what I need. And so
how do you eat that? Like, what type, let's say, what are your top 3 foods that you would eat? You must eat a lot of fat because fat is calorie dense, right?
exactly, it's not as much volume as people would think. So that's the thing. A lot of people struggle with the concept because they're just like, I couldn't possibly fit that much food in. But when you think about healthy, energy dense foods, as you just said, we're talking about mainly healthy fats or nutrient-dense protein foods like meat, fish, eggs, dairy that also contain healthy fats. So if we think about like a typical breakfast for me, and I did post this in like a later post because so many people ask me the question you're asking me now. Okay, so for breakfast, it might look like, say, 5 or 6 eggs with about 2 tablespoons of butter. And volume wise, that's not a lot of food, right? Like if you're scrambling up some eggs, you put it in a little bowl, it's not a huge volume of food, but you've got a good 800 calories there. Now, I don't usually snack, so the next meal would be lunch, and then I might have a typical lunch for me would be like beef burger patties or beef mince, something like that. I mean, I need a lot of iron. I've had a child recently, so that's a key nutrient for me.
You
And
don't
so,
eat bread with that?
pardon?
That's just the meat, no bread? Or do you?
So typically I would have like a good 200 to 300 grams of the red meat. Then we're looking at maybe half to a whole avocado, maybe some mayonnaise made with olive oil, maybe a couple of slices of cheese, right? So a nice satiating meal. I can't eat gluten, so I don't eat a lot of bread for that reason. But I do include carbohydrates in my diet at times. It's not as if I'm consciously trying to avoid them. But when you are consciously trying to prioritize nutrient dense foods, particularly iron rich foods like red meat, you actually do need quite a lot of them. So for women, you need at least 300 grams of red meat most days to meet your iron requirements. So I would rather get that in than fill myself up with bread, which isn't giving me the same iron or nutritional value. So that would be a typical lunch. And then dinner, it might look like some sausages, maybe with some potato cooked in olive oil. And, you've got to be liberal with the healthy fats. So I'm talking like 2, 3 tablespoons of olive oil, maybe some butter, maybe some sour cream. And again, it all fits on a dinner plate. It doesn't look like that much food. It looks oftentimes like the same as, most other people's meals. But because there's so much healthy fat in, you're getting a lot of that energy dense food. So, and again, like that's how you can achieve a calorie intake, in my case, of 3,000 calories a day. And I'm only eating 3 times a day. I'm not snacking, I'm not grazing. That's not necessarily supportive for your metabolism. And I'm not
Why
over.
is that? Is that because you're spiking insulin every time you eat, or?
Well, that can be a factor for people who are insulin resistant. That can definitely be a factor that causes weight gain rather than weight loss because you're just eating so frequently and not giving your body a chance to burn body fat. But there's a little bit of complexity to this because the way that I eat, I don't consciously try to meet a certain calorie target every day. And I actually don't teach my clients to do that either. What I encourage my clients to do and what I do is I eat to true satiety. So at my main meals, I will eat to satiety. And this is such an important concept that's used in the literature, especially for low carb diets. If you eat to satiety, so you eat enough protein and enough energy at that main meal to feel physically, emotionally, mentally satisfied, what that does is it improves the amount of energy that your body is going to burn each day because number one, your body's getting the energy it needs to fuel its vital organs. Your body sees lots of energy available, especially if you're not spiking insulin too frequently. And so your thyroid is able to upregulate your metabolism. So eating 3 satiating meals a day is more supportive of increasing your resting metabolic rate and getting your body to burn more energy than if you were to eat 5 or 6 smaller meals. And that's, documented in the literature, but it's also something that I see in my patients too.
Okay, can you just unpack because I'm just thinking people are going to go, oh, 3,000 calories, lots of fat, healthy, great. What if they eat sugar with that?
Hmm.
'Cause ice cream is fat and sugar. Why
Well,
does, so what, I mean, you've touched on it before, what it does to our insulin and all of that, but can you just unpack that? Just because I don't want people to go, oh, I can eat lots of fat. Okay, and I'll eat all this bread and I'll eat all this pasta. Oh, I'm not losing weight. So maybe if you can unpack that.
so important. And sometimes, I forget to cover this point, but I think when we talk about eating more food or meeting your energy requirements, we're talking about doing that through real whole foods. Foods that your body can digest easily, foods that your body can recognize as protein or energy, building blocks that it can actually use. And also foods that are not going to contribute to insulin resistance, inflammation, etc., etc. Because if you look at foods that are not real foods, I think most people can agree that they don't offer a lot in terms of nutritional benefit. But then some foods, like if we take, something, I want to try and choose something quite obvious. Like if we take like lollies, for example, or Kentucky Fried Chicken, like deep fried chicken, most people can agree that that food source isn't necessarily a health food, right? But when we think about what it's actually doing in our body, if we take the lollies, for example, so lollies are basically pure sugar most of the time, very little fat, very little protein. We're going to get a huge spike in our blood sugars. This is everybody, whether you have diabetes or not. And then your body has to release a huge amount of insulin to pull the sugar back down. So you haven't got a fantastic energy source there because you've got a little hit of energy that's just going to disappear within an hour or so. And you get this huge release of insulin that stops you from burning fat. So calories from lollies is not going to give you more energy. It's not going to support your metabolic rate. I think most people understand that it's not good, but maybe understanding why is helpful. And then if we think about the other option, something like deep fried chicken, this one might be a little bit more confusing to people because they think, well, chicken is protein, frying your chicken, that's fat. So this is everything we're talking about, right? But usually for, standard Kentucky Fried Chicken or deep fried chicken, we're talking about, crumbing that chicken in potentially a lot of refined flours and a lot of sugar perhaps added to that crumb, and maybe even some oils like refined oils. But then outside of that, we're actually frying the chicken itself in refined oil. And refined oil is used a lot in the food industry. So it's hard to avoid, but we definitely don't want to go out of our way to get it. But we're talking about things like canola oil, sunflower oil, vegetable oil, margarine. All you need to do is jump onto YouTube and just look up, how is vegetable oil made? How is canola oil made? And you don't need any more convincing than that to see that these are not foods. They're just not foods. And so if we take in fat from these types of refined oils, our body can't use them for energy. They increase insulin resistance because when that form of energy actually gets to the mitochondria in our cell, it causes the mitochondria to malfunction. So rather than producing more energy like we would if we had olive oil, these types of oils cause our mitochondria to kind of like slow down. And so we're not actually producing the energy that we're taking in.
That's so interesting. I didn't know that. Wow.
So the types of foods are so important, but it's also not complicated either. Like it doesn't have to be complicated. We're talking about real minimally processed foods.
Great. Awesome. And just what about cold meats? Salami, those kind of ham. What do you think? They're meat, they're processed.
So, I like the term minimally processed, so real foods or minimally processed foods, because like even something like butter, right? Like it is processed. We don't just like butter doesn't grow on the trees. We know it's processed. But the type of processing is minimal. So we have a real food that we can see, milk from a cow, right? We can all agree that's real food. And then there's some mechanical processing involved. There's no chemicals being added. There's very little heat treatment, and we're able to churn that milk and get butter, right? And this is a food processing method that has been around for centuries, okay? So that sort of minimally processing is, I would say quite healthy, right? And we need that processing to survive as humans because otherwise we wouldn't have enough food available. So we have to be realistic. But if we take margarine, so a very similar example to butter, margarine, you've got chemicals, you've got extremely high heat, you've got dyes to make it yellow. It's not even yellow, they dye it. And so, you don't need to even like have that much knowledge to understand, okay, when I actually see how that's made, I can see the difference. That's ultra processed while butter is minimally processed. So that can be helpful for people to actually understand how their food is made. Same thing for meat. If we look at minced meat, for example, we could say that's minimally processed because we have some mechanical processing involved that is just mincing the meat that was otherwise a relatively whole food. But if we take, say, a sausage roll isn't just mincing meat and there it's put in some bread. A sausage roll, in many cases, especially the ones you buy in like the frozen section or you get from certain fast food places where it's sitting in the oven already ready made, you're getting a lot of ingredients added to the meat. So when it's being minced, you're getting potentially some sugars, potentially some refined oils, flours, and things like that being added. And then you're going to get preservatives. You might get some dyes or artificial flavors thrown in there as well. And then oftentimes, with the pastry that's going on the outside, that's going to be cooked in those refined oils that we were talking about. So yes, the pastry comes from wheat, nothing against wheat, but that wheat has to be ultra processed or ultra refined to turn it into something like pastry. And so it's about seeing, well, how many steps are in the process of processing these foods? And I think when it comes to things like cold meats, this is a gray area for a lot of people. And I would say that's because there's so many different types of cold meat. So you can't put all cold meats or preserved meat, some people would call them, in the same category. So if we think about something like, let's say ham, right? So you can have ham that is preserved with brine or salt water, and that's really one of the only things that's being used to preserve the ham. So preserving food in brine, again, it's a method that has been around for centuries, right? And if they're not adding too much else to it, maybe they're adding a little bit of herb or spice or something like that, then it's probably not so bad for us. If we compare it to something like, and I won't say all salami, but certain types of salami, if you just look at the ingredients list, you might see a big paragraph of ingredients where, again, you're getting preservatives, refined oils, you're getting dyes, and like artificial ingredients that you won't even be able to recognize. You'll just see this big paragraph. So if we compare that with ham, you've got pork and salt, if it's a good quality ham. And if we compare that with, certain types of salami or other processed meats, we're going to have a big list of ingredients. So yes, they're both preserved in a similar method, but one has a lot of ingredients, additives, artificial preservatives, all of that added to it, and the other one just has salt. So they are in the same category. I totally understand that, and it is a confusing one for people. It's hard to say, yep, all cold meats are great, because some of them definitely aren't. But I think if you're ever unsure, just read the ingredients list and compare it with other ingredients lists in the same category. So if you want to buy ham or you want to buy cold meats, have a look at a few different types in the supermarket or at the butcher, and then find the one with the smallest amount of ingredients added.
That makes sense. Jess, I think we've been speaking for a while, and I've got so many more questions to ask you, but hopefully we'll have another chat separate to this one. Thank you so much for coming on today. This is such valuable information, and really, I mean, nutrition is, what we eat is what we are, and what we're able to produce for the world, and what we're able to do. Our energy comes from what we eat. So thank you so much. Such important information. And hopefully we'll see you soon again.
Thank you for having me. I'd love to be back one day.